if we think about all this data and try to summarize some of the key findings that we found and points of interest, I would say a couple things. First, a higher number of these nerves than expected showed a very coarse or abnormal neural trajectory. 1 in 4 nerves from the overall study population really showed that very coarse. Almost a third of nerves were fixed to the thyroid capsule, rising to 50% with substernal goiter. And then 40% of all nerves overall were entrapped at the ligament of Berry. And all of these anatomic variations were found by meta-analysis in this study to increase the risk of neural injury. More extensive surgery, greater extent of RLN dissection also increased the risk of nerve injury. In agreement with the literature, our nerve injuries were mostly traction injuries at the ligament of Berry, number 1, and at the thyroid capsule, number 2. And then greater than 80% of these injuries resulted in vocal cord paresis or paralysis, with 40 to 45% of these being symptomatic. Nerve mapping with neural monitoring was helpful for prognostication as well as for the mapping of neural trajectories and delineation of neural injuries. And then post-op laryngeal exam is important as a means to more accurately predict post-operative neural outcomes. And it also allows for the identification of asymptomatic vocal cord paresis or paralysis, or those minimally symptomatic patients who may benefit from earlier post-operative interventions.